going. Hey everybody, good afternoon. It's 12:45 on a Tuesday, which means we're going live with questions that people have been sending us in all week and answering about some topics that have come up over the week, and just generally doing our best to help educate you with a broader knowledge of aspects of health when people start to think about what is important for them to make choices about. Today we got a few questions that we want to talk about. We want to talk a little bit about blood pressure and cholesterol. We're going to talk a little bit about digestion, gallbladder problems. So a broad spectrum of things that we're going to talk about today. But if you have a question and you want to ask it while I'm talking, please go ahead and type it in there. If it's a question you want to have us address next time, just email us at info@strongonhealth, and we'll talk about that Thursday at 12:45 when we go live then. So today, first of all, I'm going to put an article below about raw nuts and seeds. One of the things I want to always do for people is give them something to move towards, something to choose, something to select that is going to help them. And there's so much evidence out there that continuously shows us the benefits of raw nuts and seeds. In the clinic every day I have a different raw nut and seed that I eat, and Tuesdays I eat my cashews. So this is what I do every Tuesday, is a handful of raw, sprouted, organic cashews. There's a lot of micronutrients that I'm getting from this, and that's why I try to change it up every day. Fort Worth is becoming a blue zone. This is amazingly huge, great big news. This Saturday, the 10th, they're having a great celebration in Fort Worth, and what a blue zone is National Geographic went around the world and they discovered where people were the healthiest, where they lived the longest, where they had the lowest rates of obesity, the lowest rates of heart disease, the lowest rates of cancer. And they found commonalities that they had, and there was what they call the Power 9. So familiarize yourself with those and start to do one of them. One of the things I discovered is that they all eat a handful of raw nuts and seeds every day. So for me, that is something that I've incorporated into my life, and I've found that it's really simple to do it. It's something that I enjoy doing and something that adds a lot of benefit. If we think about the things that Americans are missing, there's a lot of micronutrients that are missing, a lot of vitamin B's, you're getting that in this, a lot of magnesium, you're getting magnesium in this, and a lot of fiber is missing from the American diet, and you get fiber from those nuts and seeds too. So if you do nothing else after watching this, make sure you try to incorporate a little more raw, organic, and sprouted, if possible, raw nuts and seeds into your life, because those are going to make a big difference for you. And for those of you who are in the Dallas-Fort Worth area, this Saturday is a great event. I'm going to be there, so I look forward to seeing all of you out there who want to learn more about how to, or why we've become a blue zone here and what that means for you as an individual. So we have questions right now because we're doing the reboot, which is November. We always talk about this being the perfect opportunity to clean up your diet as best as possible. We had Halloween ending, and we got Thanksgiving and the rest of the holidays coming, so we get this perfect window of 21 days to make the best choices to reduce in your life those things that are stressing your body, and increase in your life those things that are going to help heal and nourish your body. So for me, what does that mean? I'm going to be removing all alcohol for this 21 days. I'm going to be removing any breads, any sugars, anything that's processed or refined. Those are the things that I'm not going to be putting into my body, to give it an opportunity to get ready and rested for the battle that's going to come to my liver over the holidays. So we take this time to do that. And if those of you who haven't joined us in this time, you don't have to do anything particularly special other than reduce those things. And I just challenge all of you to commit to, now until Thanksgiving, to really reinvigorate your commitment to your health and take a little more time in thinking about whether or not that cake pop is worth it today, because you're going to be eating a lot of those over the holidays. So think about reducing those refined carbohydrates, those sugars, those cakes, those breads and alcohols until Thanksgiving, and have an experience with that and see how much of a difference that makes in your life. We have a lot of people who come talk to us because they have digestive problems. We actually have some people who are doing this program with us right now and experiencing some digestive problems, people who've had to take acid-stopping medication, people who have had to have their gallbladder removed. I really want people to understand that you have to digest the food in order to get the benefit from the food. And if you are diminishing the acid in your stomach all the time, you're really making it hard for your body to do anything with protein. And you're actually setting yourself up for a whole host of problems down the road, and this is well documented. So be careful with the overuse of things like Tums and the overuse of antacid medications, because it can create more problems. So try to understand why your body is having a hard time digesting it. That's even more important, and that's what we're here to do, is to help you, educate you on that. We have a great book that we offer people here called Why Stomach Acid is Good for You. I encourage all of you to read at least the first couple chapters of it. It's really important. We also have a book here very small book, so you don't have to read the whole thing as we're concerned about over there, about gallbladders, because gallbladders are really important when you're eating fats. You need to have that bile to help you emulsify the fat. So understanding how these impact you when you are experiencing things like nausea or diarrhea or constipation or burping or bloating, all of those have to do with an impaired digestive system. So it's a communication feedback from your body telling you, hey buddy, can you work on your digestion a little bit, because we're not getting the benefit from all these foods that we're eating. So really take that information from your body and find out what that means. And if you have reached the limits of your knowledge with that, find someone who can help you be educated on what that means for you. So don't just dismiss those and treat the symptoms by trying to stop that acid all the time. Make sure you're understanding what that means for yourself. Okay, so we have some questions about blood pressure too. So blood pressure can be very complicated. And it's very important to keep an eye on this, because heart disease is the #1 killer in our country. We have somebody, unfortunately, who is having a heart attack every minute in this country. And so this is something we do want to be mindful of. But there are many, many roads to increase blood pressure, and we have to understand that. One of the things that can impact that is nutritional deficits. Magnesium actually being one of those things that can make a major difference in whether or not somebody's blood pressure is going up. But there are many other things. Potassium can be a nutrient that has something to do with that. And so when somebody has that, again, this is information from your body that something is happening and your body's responding to it. And you have to figure out what it is and what can you do to help your body to have an appropriate response to that. And what is it that your body's trying to tell you? So we are concerned about heart health a lot. In fact, so we do have a book that I handed out here earlier. We have a whole stack of them called Put Your Heart in Your Mouth. And this is another excellent book for somebody who wants to know about heart health. To me, it's a must read. For those of you who are concerned about your heart health, it's a great gift over the holiday. And again, don't feel like you have to read the whole book. Just commit to reading like the first couple chapters so that it can get your interest hooked and get you going. Thank you. This is the book. Yeah, and there's a lot of recipes actually in it, so it's not that long. But it is worth to take a look at that, because it can make a big difference for you. Because a lot of times people get really concerned and confused about cholesterol because of what they've heard about cholesterol for so long in their lives. And one of the things I just want to make sure everybody understands out there is that your body naturally makes cholesterol. It can make a lot of cholesterol on a daily basis. So it's part of the actual design of the body to have cholesterol, and it has many, many purposes. Now, when you're looking at elevated cholesterol, that can be what they call a risk factor for certain things. But again, you have to understand, why is it going up? So a lot of times what we want to be helping people understand that there are inflammatory markers. Inflammation can also drive up blood pressure, and it can affect the cholesterol levels. So inflammation is a very important thing to look at. And if you are concerned about it, I would encourage you to talk to your doctor about inflammatory markers. The ones that we tend to talk to people a lot about are homocysteine, C-reactive protein, lipoprotein A. Those are things that help you understand what your inflammatory state is, because a lot of those can be corrected with lifestyle, or they can be aided with lifestyle choices and made a big impact on that. When you are stressed, though, I really want to make this important note for people. Your cholesterol is going to go up because your body needs that cholesterol to make the things that your body makes when it's responding to stress. There was a really interesting study that was done on the race car drivers, Le Mans race car drivers, since we have that going on here right now. And they took their cholesterol before the race, during the race, and up to 30 days after the race. And because of the stress of that, their cholesterol was elevated. And they found the same thing happened to people around April 15th every year because of the stress. So stress will increase it. So I just want to caution you to know that if you go in and it's slightly elevated, maybe talk to your doctor about the fact, do you think this could be elevated because I'm stressed right now? Maybe we should check it when I'm not stressed, instead of just saying that I have to be on something that's going to force it down the rest of my life. It's just worth having that conversation, because there are side effects to these things, and sometimes people don't realize what they're trying to fix it with other things can be a side effect to something that may have been appropriate at that time, but it might not be all the time. So we do have another question here right now. Can I talk about circulation and inflammation and how what we eat affects that? Absolutely, Mark. Thank you for the question. So there are a lot of inflammatory foods out there, and that's one of the reasons we do the reboot. A lot of processed foods, refined foods, things that are causing inflammation in the body, especially sugar. I stopped talking about sugar because I talk about it all the time, but the average American is eating about 6 times the amount of sugar that the World Health Organization deems healthy in a day. and that sugar can be incredibly inflammatory. And that's not the only thing that is going to be contributing to inflammation, but trans fats, fats that have been hydrogenated. So partially hydrogenated oils, fully hydrogenated oils, all of those can be increasing inflammation. And anything that is in that category can be increasing inflammation because your body's trying to respond to what you're throwing at it. But when you remove those and you start to give your body the things that it can take to resolve inflammation, you can get a major impact in helping that with your body's ability to deal with all kinds of things systemically as opposed to just that. So again, one of the reasons that we put our intention on these 21 days of trying to remove those things and increase those things that are going to help with that. And Mark, if you have more questions on that, I'd be more than happy to answer those for you, but please keep those questions coming for us. But I think that might be all of the topics that we wanted to cover for today. Remind you guys again, the Blue Zones event is this weekend in Fort Worth. I'm sure you can find some more details online if you look up Blue Zones Fort Worth. I'm going to put a link below about the value of those raw nuts and seeds. Keep doing those things. Keep thinking about things you can do to incorporate into your life to make you healthy. And if you guys have any other questions, we're here to answer them Tuesdays and Thursdays, noon to 1. We go live at 12:45. So thanks for watching, guys, and have a great day.